Sugar. Sugar is found in almost everything that we eat and drink on a daily basis. Now, we've all had those times where we have a sweet tooth and you want to go to the store and get a candy bar or go down to Brahms and get some ice cream to cure that. Well, not everybody can enjoy the sweet taste of sugar. I'm talking about diabetics or diabetes. I'm here to inform you regarding the two types of diabetes and what can happen with those two types and how diabetics live on a day-to-day basis. I'm going to start off with type 2 diabetes. Type 2 diabetes is non-insulin dependent. You can talk with your doctor. Sometimes you can manage it with diet and exercise. Sometimes you may have to be put on oral medications to help lower your blood sugar. And that's essentially what diabetes is your pancreas, which is used to produce insulin, therefore lowering blood sugars, lowering your level of glucose that's circulating in your body. And with diabetes, you run a high blood sugar a majority of the time because your insulin isn't working as well as it should. With type 2 diabetes, your body just doesn't use the insulin like it should. Signs and symptoms of type 2 diabetes, well, type 1 diabetes as well, you consistently thirsty, losing weight. Sometimes you can get a little confusion with it if your blood sugar either gets too high or too low. The good thing with type 2 diabetes is, like I say, you can be managed by diet and exercise. If that doesn't always work, which I know a lot of people who have type 2 diabetes who don't, just can't get to the gym like they should and have to be put on medications. That is type 2. Type 1 diabetes, or insulin control, meaning you have to have daily injections of insulin to keep your blood sugars at a manageable level. It only affects about 5% of all diabetics who have the diagnosis of diabetes. Type 1, meaning your pancreas does not produce enough insulin to lower your blood sugar to an effective level. Whereas type 2, your pancreas produces the insulin, it's just your body doesn't use it to its most effective capability. So with type 1, generally requires them to have daily checks of their blood sugar, sometimes once a day, sometimes up to 5-6. Most of the time they are on insulin injections, although they're making great marvels with technology today, but most of them have to do subcutaneous injections of insulin. Treatment wise, you do the insulin. If you don't do the insulin, then we get into some complications. As I said before, diabetes is a life-changing disease that requires the strictest intake of carbs and sugars. You do not do that, then you're in for some trouble. Some of the signs and symptoms of diabetes, if you're not controlling your blood sugars, can go anywhere between peripheral neuropathy, having some numbness and tingling in your toes and fingers, vascular problems, heart attack, stroke, high blood pressure, and even in some cases, amputation. With diabetes, your body is not able to heal as well as it should, therefore prolonged healing. With having said all that, in conclusion, whether you have type 1 diabetes or type 2 diabetes, it is very important that, one, you get it diagnosed early. If you have a family history of diabetes, you need to go get it checked out. 2, if you are a diabetic and you do have the diagnosis of diabetes, you need to follow the treatment plan that has been laid out from your doctor. Without that, you're in for a life of misery, and like I say, with the neuropathy, with the amputations, the prolonged healing, you need to follow your plan of care that you and your doctor have come up with. So, in conclusion, if next time you have a sweet tooth or decide to go get a candy bar or a soda at the store, just keep in mind that not everybody has the ability to be able to do that, and make sure you always get your annual physicals done to check it. Diabetes, it's better to catch it early than wait 10-15 years down the line where you have those severe complications. Thank you.